Hello everyone. So now we are going to talk about group B streptococcal infection. So this is an important thing because the sequelae or the consequences of group B streptococci is much more. So we need to know is very severe. Therefore we need to know when we are supposed to give treatment, when we are supposed to give in prophylaxis, what is the indication and what is not an indication. So before we delve further, we should know this group B streptococci, what it is and whether it is a gram positive, gram negative, rod or cocci. Group B streptococci is streptococci agalactiaceae. And this is gram positive cocci, that is group B streptococci. Now what can only this infection can only be caused by group B streptococci sepsis. So is it only caused by group B streptococci, that is streptococci agalactiaceae? No. There are two other organisms which can also cause a similar sepsis, that is E. coli as well as Listeria. E. coli is gram negative rod and Listeria is a gram positive rod. So they all three can result in this condition. Now when are we supposed to treat them? What is the indication? When there is a positive urine culture in the pregnant female, even during the first trimester of pregnancy, but now before delivery the culture is not positive, still she has to be treated for group B streptococcal infection. So positive urine culture in first trimester, that is one indication. The second one is when there is a positive rectovaginal swab. Even when the swab from the rectovaginal area, when it is positive, then that is also indication for this treatment. Thirdly, if there is rupture of membranes for more than 18 hours, then that can also be an indication. Unknown status, we don't even know what is the status of that pregnant woman is, and she is presenting with fever. In that case, it can be an infection from this group B streptococci. So therefore that has to be treated. Then if the previous pregnancy, if they have a child who's been affected with the group B streptococci, like the child had suffered from pneumonia, sepsis, in that case, then the group B streptococcal infection should be given in the now prophylaxis should be given in the current pregnancy too. In addition to it, when there is a preterm delivery, that is less than 37 weeks, that is also an indication for group B streptococci. Now I have certain things to clarify. You might wonder, why should an unknown status with the fever be treated for group B streptococci? So the thing is, why not we check whether they are positive for group B streptococci and then treat them instead of unnecessarily loading them with antibiotics for treatment. The thing is, adequate prophylaxis should be given to prevent the group B streptococci from causing pneumonia or meningitis in the fetus. What is adequate prophylaxis? Adequate prophylaxis is the treatment with ampicillin as well as gentamicin within the first 4 hours. If we want to know whether there is organism, that is culture can be done, or even any method can be done, we won't be getting the lab results within the 4 hours of delivery. So in that case, the consequence that it causes, that is when the baby is affected with pneumonia or meningitis, is far more severe than the adverse effect which is caused by the treatment. So therefore, even if we don't know the status, therefore even if the baby is preterm delivery, then there is high chances that the baby can have the infection. Even if there is a rupture of membranes and we don't have any evidence that it is affected with the group B streptococci, still we treat them. The worst part is, even when the previous pregnancy the baby is being affected, even in that case we don't want to take a chance. So therefore we treat them with antibiotics for group B streptococci. What is not an indication? In previous pregnancy, instead of the baby being affected when only the culture has been positive, but there is no problem in the baby, in that case it is not an indication for group B streptococci. So, when only when the culture is positive in previous pregnancy, that is not an indication. So, what do we treat it? What is the treatment? Ampicillin and gentamicin is the treatment. What is the reason behind ampicillin as well as gentamicin? The reason is ampicillin acts by inhibiting the cell wall synthesis. Gentamicin acts by inhibiting the protein synthesis. Ampicillin as well as gentamicin is also effective against E. coli as well as Listeria, which are also common organisms that can cause the condition. So, therefore, the treatment is ampicillin and gentamicin. Now, there might be certain questions which can ask you, can ceftriaxone and vancomycin be used? Vancomycin is useful in methicillin resistant Staphylococcus aureus, and when ceftriaxone is used in a neonate, that can displace the bilirubin and it can result in jaundice or even kernicterus. Therefore, this combination is not needed. Similarly, amox and clavulanic acid, if you take, that is also useful against methicillin resistant Staphylococcus aureus, and we don't need to use for this group B streptococci. The simple ampicillin with gentamicin is the cure for it, is the treatment for it. What is adequate prophylaxis? Giving this medicine, now the drug, within the 4 hours after delivery of the fetus is the adequate prophylaxis. That is what we should know. So, this is in short about group B streptococci. So, these indications might confuse you, but the message is, instead of having the disease, we are just extra cautious. That's it. So, I hope this helps to you. Thank you.